Good evening. Today I would like to inform you about the numerous benefits of utilizing cannabis as a natural medicinal treatment in physiological and neurological disorders as a replacement for narcotics. Cannabis involvement in current scientific studies leads to being a natural method to combat neurological disorders in humans versus using narcotics. Each day, 46 Americans die from prescription narcotic overdose. These drugs are being prescribed for an array of things ranging from a pulled tooth to a debilitating disease that is slowly killing someone. I would like to inform you about a natural alternative you could be using in order to help fight these statistics. Marijuana has been on the planet perhaps longer than we humans have. It has been used in ancient times as well as in modern times. Medical marijuana has multiple medical uses, and there have been ongoing studies happening for decades. Firstly, allow us to delve back 10,000 years ago to ancient China, where the Chinese leader, Emperor Xin Nong, who was also a pharmacologist, wrote a book on treatment methods that included the benefits of cannabis. He suggested the use of cannabis to cure ailments such as gout, constipation, rheumatism, and shockingly, absent-mindedness. And now, back to modern-day colonial times, where an Irish doctor, William Brooke O'Shaughnessy, is given credit for introducing the use of cannabis as a therapeutic treatment for muscle spasms, stomach cramps, and common pain in general. As one can imagine, the medical use of cannabis has only furthered since colonial times. Common beneficial effects accepted in today's medical environment are for chronic pain as well as muscle spasms. Although acknowledged but not generally accepted is that medical-grade cannabis reduces nausea during chemotherapy, can improve the appetite of an HIV or AIDS patient, improve sleeping habits for patients with insomnia, and further improve reactions from patients with Tourette's syndrome. Now, with that said, I would like to say this, that the current government classification of cannabis as a Schedule I drug makes researching the miracle plant incredibly difficult. In the lab studies that have been completed, however, CBDs or cannabinoids show multiple anti-cancerous effects, ranging in properties from anti-carcinogenic, anti-tumor, to even having a potential effect on lung and breast cancer cells. Another laboratory find is the reaction among serotonin and acetylcholine, allowing for the potential of dampening the effects of Alzheimer's disease. A scientific lab review has stated that one compound known as cannabidiol has demonstrated potential to positively affect symptoms such as congestion, nausea, inflammation, convulsion, cough, multiple sclerosis, and to inhibit cancer cell growth. Other clinical studies have shown potentiated effects in psychological diseases such as psychosis, anxiety, and depression. To conclude, one could say that there are multiple different ways medical marijuana can be used as a treatment in a variety of disorders. Now that you have the knowledge pertaining to the history of marijuana, you have the knowledge given to us today as a consumer, and you have read about a small number of the multiple different fields of research medicinal marijuana is involved in. I digress. In America, there are over 100 million doses of opioid narcotic prescribed per year. 75% of opioid addiction disease patients switch to heroin as a cheaper opioid source. A study published in the Archives of General Psychiatry shows that heroin addicts have only a 50% survival rate. I want you to know that not a single person has ever died from a marijuana overdose.